Hello, I'm back again. This time I'm going to talk about my third open heart surgery. I may cover the other two in another video at some point, but I don't really remember a whole lot about those because I was pretty young when that happened. The first one was in 1976. I was like 3 years old. The second one was in 1985. I think I was 12. So I remember that one more than I do the first one, obviously, but still, I'm just going to go over this third one right quick because it was an unusual procedure. At least that's what the doctors told me, that it was unusual. They usually don't do this kind of thing. So what happened was I was working at a cotton mill for about 11 and a half years, and then they went out of business. So I didn't have any insurance. After that time, they didn't offer any kind of COBRA insurance. That time, COBRA is just where you get insurance through wherever you worked at, but whenever you were working there, you just pay like 25 or 30% of it. And you can extend that out after your separation from the place. But you have to pay 100% of the premium as opposed to just paying like 20, 25, 30%, whatever it was. You had to pay 100%, which is quite a bill in the month. But that wasn't offered when the plant was closed. What was offered, though, was a chance to go back to school. So I took the rest of the year off in 2004. The plant shut down at the end of October. I took the rest of the year 2004 off, and I said, beginning of 2005, I'm going to go back to school. And I did. I went to North Georgia Technical College, which is about 25 minutes away from here. And I signed up for the pharmacy technician course because I was looking for one that was kind of, I don't know, kind of middle ground of how many unit hours you had to do. So I didn't want to stay in there forever. I mean, unemployment only lasts for 2 years. And I'd already eat up 2 months of that, just taking the rest of the year off. But nevertheless, the schooling still took me 2 years. But I did graduate. I graduated with honors, which was odd considering I just got a general diploma from high school and just really didn't care about school at that time. I just totally screwed up regular school, but anyway, moving along. At the end of 2006 was when I finished school. And I decided then, well, might as well just take the rest of the year off, look for a job in 2007, which is what I did. Now, whenever I'm in this pharmacy technician program, you do what's called clinicals. I've done 2 clinicals in a retail setting and 2 clinicals in a hospital setting. The 2 retail ones I did not care for. I said, I'm not going to work in retail, so that was off the table. The 2 hospital settings, however, I did like. One of them I liked more than the other one. The one I didn't like turned into a job in 2007. And I didn't even fill out an application. They called the school to find out where I was and get my number so they could call me. I guess they liked me, I don't know. But I worked there long enough for them to get me trained. And the other place where I'd done the clinicals, Habersham Medical Center, which is probably about 25, 30 minutes from here too. they offered me a full-time job. They never offered me a full-time job at Chestatee, which is it's probably about 40 or 45 minutes from here over a mountain, and I didn't want to drive that every day anyway, so they got me trained, and then I got a job offer from Habersham, which was full-time, so I took it. I was going to stay on at Chestatee kind of PRN, but later on decided I liked my days off too much, so, and besides that, I didn't really need the work that much. I just needed a job where I get some insurance. You can't get insurance if you got pre-existing conditions. At that time, I mean, now you've got Obamacare where you can get insurance with pre-existing conditions, but can't afford the premiums, and then if you do get sick, you can't afford to use it. So I guess what you do is you pay the premiums for the insurance so you don't get fined when you get your taxes done, and then hope like hell you don't get sick. But that wasn't an option for me because Obama didn't take office until, what was it, 2009? And Obamacare didn't take effect until like 2010 or 11, I think. But nevertheless, I had a full-time job at Habersham Medical Center, which give insurance. Now, I did have a 1-year waiting period on pre-existing conditions, which I had a multitude of. So, but that year had come and gone. But at the beginning of 2009, I started noticing that I was getting out of breath more and just wasn't feeling right. My heart wasn't beating right. And I was thinking something's wrong. So I went to my doctor, and because I hadn't seen a cardiologist because I hadn't had insurance in over 2 years. So I hadn't seen a cardiologist because that was one of the things I had to drop. I was supposed to, I take Coumadin, and you're supposed to check your blood every so often to make sure it's not too thick or not too thin, because I have an aortic valve implant that's from the 85 operation. But that's kind of a tricky thing. If it gets too thin, you could go into internal bleeding or whatever. You bruise real easy and get real cold in the wintertime. And you bleed if you get cut pretty easily. And if it gets too thick, blood can clot onto that mechanical valve, which can cause other problems, such as stroke. Blood clot breaks loose and goes to your brain. Stroke. But I knew I wasn't feeling right, so I got my doctor set me up with a cardiologist, and that was at Northeast Georgia Physicians Group, I believe, in Gainesville. And they saw me for a while, but then something happened at the end of 2009, which I'll make a video of at some point. It was in November of 2009. I started getting bad headaches and stuff, but I wound up having to go to the emergency room for that, and turned out that I had some kind of a growth in my brain. They didn't know what it was, but it was affecting my eyesight and causing me to have bad headaches. So they sent me on down to Gainesville for that, and they operated on that and removed it. But like I said, I'll do a video about AVMs some other point, a separate video. But after that surgery, I had a problem that I'd never had before. And when the doctor told me about it, he just kept saying irregular heartbeats. And I'm like, yeah, every now and then it just goes irregular. And he says, but not like this. But he never mentioned the words atrial fibrillation or A-fib. See that in them commercials for them blood thinning medications. What is it? Pradaxa. It's not for people who have atrial fibrillation, which is a heart problem, not caused by a heart valve problem. But anyway, in order to fix that, they actually have to bring you into the hospital, put you to sleep, strap electrodes onto your chest, I think one on your back, and actually defibrillate you. Now, the video yesterday that I done was about the defibrillator that I've got implanted now. I didn't have that then, but that wouldn't have helped the A-fib, which I still have. This thing's not helping with the A-fib, but it's helping to kind of measure my heart out so that the A-fib's not as noticeable. But after they fixed that, I was fine for a little while, but then I went back to the doctor and he told me if I didn't have a heart operation within about 6 months, I was going to die. I mean, it was like, you have a heart operation within 6 months or you're going to die. Now I got to get to the next patient. I'm like, what the hell? He says, come back and see me in a couple of weeks. So I went back to see him a couple of weeks. I took my mom with me this time because I was like, this guy won't even talk to me. And he tells me I need a heart operation or I'm going to die. And just leaves. He basically done the same thing again. But he didn't want to have nothing to do with it. That's why they're considered the #1 heart group in all of Georgia, because if they come up with a case that they can't deal with, they ship you off somewhere else. You can claim to be the #1 heart center in the entire state if you're not going to work on anything that's hard. At least that's the way I see it. But they sent me to Emory Healthcare in Atlanta, Emory University Hospital. And I saw them and they told me that the situation wasn't quite as dire as what he was saying. So they took me in with open arms. I mean, my first 2 operations were at Eggleston, which is a branch of Emory Hospital. In fact, it's just down the street. It's called Children's Healthcare of Atlanta now. But back then it was called Eggleston. And they took me in. And I saw them a few times. They done a cardiac cath, which is where they send a probe up through the arteries in your leg to go into your heart to look at it from the inside to see what the problem is. And what the problem was I had what's called mitral stenosis. I had atrial stenosis back in 1985, which is why the atrial valve had to be replaced. And with the mitral stenosis, the easiest thing to do is just replace the mitral valve. Unfortunately, the mitral valve is right beside the aortic valve, which I'd already had replaced. So they're like, okay, we got a study on this. So they sent me away and told me to come back in a couple weeks. And they had discussed it and they figured out a plan. Instead of replacing the mitral valve, what they were going to do to get more blood flow out of the heart, which was causing me to be out of breath and everything. And this was in 2011. But what they decided to do to get more blood flow out of the heart was an unusual procedure where they actually they cut a hole in the bottom of your heart and put what's essentially a pipe in there. And it runs around out of the bottom. Let's see. Essentially runs out of the bottom of the heart and then over to the descending aorta, which carries blood to the rest of your body, instead of it comes in through the aortic valve, out through the, well, it comes in through the, yeah, it comes in through the mitral valve and out through the aortic valve, but because of the mitral valve the way it was blocking part of the aortic valve, the artificial one that I have implanted. Well, the heart's right about here. But anyway, it was blocking part of that. So in order to get more blood flow out without going in there and messing around with the mitral valve, because the surgeon even told me that they could try to replace the mitral valve and fix it, but the problem there would be they could cut out the valve and then not find a way to put a new one in. So in order to get more blood flow out of my heart from where the aortic valve was blocked by whatever was growing around the mitral valve, causing the problems, plus there was a lot of calcification and scar tissue there from the previous operation. That's what they come up with, putting the hole in the bottom of my heart, running a tube out of the bottom of my heart to my descending aorta. So now the blood had two paths out of the heart. What could go out through the aorta and then down through the rest of my body. And through the conduit is what they called it. It's a pipe, I think it's got a valve in the middle of it, a mechanical valve. I don't know what makes it work, but they tell me it's going to be replaced at some point in the future, but I don't know when. But this conduit, it has a valve in the middle of it to allow blood out into my aorta, which sends it to the rest of the body, to the brain, to your legs, your arms, everywhere. It supplies blood everywhere. And they told me it was an unusual procedure. They don't usually do that. Now, where they went in at was right here. You can barely see the scar anymore, but the scar goes all the way from here around to here. So, I mean, it's way on back there, all the way to right here. And then they use something to spread the ribs apart, and then they worked on it through the rib cage rather than removing a rib or any kind of surgical procedure on the bone. I don't know how they do all that, but it's amazing what they can do these days. But they done that and it didn't really help me. Still felt just as bad. But after I had that procedure done, they put me on light duty at the hospital, because by that time, because of what I'll get into on another video, I was no longer working in the pharmacy. I was working in a more labor-intensive job in the laundry, where I was delivering linens. I couldn't work in the pharmacy anymore because of memory issues and vision problems. But that's for another video. And I'll also get into why my belly is so big. I'm sure you saw that. I'll get into why that is so big too in another video. But really, that's all I got for this one. Just my scar. And I'll tell you what, the doctors even told me they don't usually do that kind of operation where they cut you right there, because it never exactly heals up just right. And they're right, because it still hurts me all the time. And I don't complain much, but yeah, at times this does hurt. Sometimes it catches, sometimes it feels like a ribs overlaying another one, and it just hurts like a catch in there or something. But I mean, it's improved a lot since 2011. For a while there, it was bad. I mean, it felt like I had a giant box over here. I couldn't even close my arm down on it without it hurting. But that's really pretty much all I got for this video. I don't know exactly what that tube procedure is called. I know it was a conduit from the lower part of my heart to my aorta, like I said, but I'm not sure exactly what that procedure was called. I know the night before the operation, the doctor came into the room to ask me how I was and everything. And then he said, "Are you nervous about tomorrow?" And I'm like, well, you know. And before I get anything else out, he said, "Because I am." I'm thinking, the doctor's nervous? What the hell? What'd I sign up for? But he done a great job. I just thought it was odd that a doctor would say he was nervous before operating on somebody. But he done a good job. I have nothing but high esteem for everybody at Emory University Hospital, even with the problems I had with the defibrillator that I talked about in my last video. I have nothing but admiration for those people. All my doctors, they were wonderful. But that's all I got for this video. Until the next one, I will see you then.